This video is going to talk about when things aren't working. So, for different reasons, things are working abnormally. So, first is immunodeficiency. So, this is going to be where your immune system isn't working well. So, it can be for different reasons. So, it can be either congenital, meaning you were born with it, or it's acquired, meaning it's caused by an infection most often, or something happened to cause it. So again, it's either all of these cells are not working appropriately or you're not making them. So if you're not making lymphocytes, then you're going to have issues. If they're not working right, then you're going to have issues. So one that is congenital, so this is going to be something that born with, is severe combined immunodeficiency syndrome. So it's a genetic condition. That's what makes it congenital, meaning you're born with it because it's based in your genes. There's a mutation. And there's issues with both B cells and T cells. Either your B cells and T cells are inactive, meaning they don't work, or you're missing lymphocytes pretty much, or these type of lymphocytes. It is an autosomal recessive condition, meaning both your parents have to be a carrier of the condition or have it themselves. So to get that, you have to have, most often it's going to be carrier. So mom and dad have the gene, and then there's a 25% chance that you're going to get it. So having both of the gene mutations will have it. So if you have malfunction or missing B cells and T cells, well, B cells are the humoral immunity making antibodies or making plasma cells that make antibodies. And T cells are the cell mediated. So you don't have them or they don't work. So treatment is a bone marrow transplant, meaning you can kind of transplant in working B cells and T cells so that you can build an immune system. So that's going to be how treatment works. Until then, you have to avoid anything that's going to cause an infection, because any infection without having both kind of major sections of your immune system, just having your non-specific isn't enough to protect you. So you can easily have severe infections and die from an infection without this type of immune system. The major one of immunodeficiency that we talk about with acquired is AIDS, and it literally means acquired immune deficiency syndrome. This is going to be because of HIV. HIV is human immunodeficiency virus. That's what it's causing. And it interferes with the activity or the working of helper T cells. So remember, helper T cells are our party planners, where they're sending out messages and invites to all the different areas. So they're sending invites to T cells. They're sending invites to macrophages. They're sending invites to B cells. Without all these invites and this coordination, then helper T cells do, you have no immune system. So they need to be there to coordinate. So you take out the helper T cells, you take out the immune system. So some of the signs that you see is weight loss, night sweats, swollen lymph nodes. But the major thing is, since you're taking out the immune response, then secondary infections can come in. So you have no immune response, then easily things that the immune system could fight against can't. And so that can come in and cause issues and even death. We also have autoimmune disorder. So this isn't just kind of an underactive immune system like the immunodeficiency. This can be more, it's acting against itself. So auto means yourself, and immune. So basically, the immune system can't recognize your cells from abnormal cells. So it actually starts attacking your body. So you can produce autoantibodies. So that's from humoral system of B cells. So they can produce antibodies against normal cells. And cytotoxic T cells can start killing normal cells that aren't infected with anything. They're just a normal cell doing normal cell things. And cytotoxic T cell can come in and kill it. So it's not meant to be killed. It's not infected with anything. And antibodies can come in and surround a cell, saying that it's something bad when it's a normal cartilage cell or something like that, chondroblast. So we have many types. Multiple sclerosis is going to actually destroy myelin. So remember myelin sheaths around axons. So it's going to attack the myelin. So you're actually affecting the nervous system. Myasthenia gravis is going to actually impact where the synaptic knob of nerves come into muscles and that connection. Graves' disease is actually going to cause hyperthyroidism, so it's going to increase thyroid hormone. Type 1 diabetes, not type 2, diabetes mellitus, is going to be an autoimmune condition that attacks pancreatic cells, specifically the ones that are producing insulin. So you have an insulin dependent diabetic. Lupus, systemic lupus erythematosus is going to be multiple organs. Glomerulonephritis is going to attack the kidney. Rheumatoid arthritis attacks joints. So it's all areas that these are normal things, but it's attacking kind of all these normal cells and causing these disorders or diseases. So we have immunodeficiencies, we have autoimmune. This is hypersensitivities, meaning it's going to be an extreme or increased immune response to an antigen, and oftentimes these are going to be allergies. So pollen can be an antigen, but usually it's not something that we really need to cause a lot of inflammation and cause a lot of immune reaction. But with allergies, we do. So we can get to the point where neutrophils and cytotoxic T cells are actually just really excited and they start destroying normal cells along with the antigen. So they're just kind of killing everything they see or eating everything they see. You can get inflammation. That's going to be a large part of the symptoms of allergies that you see, is going to be the antigen antibody complexes that you can see. And so anything that's causing the allergic reaction is an allergen. So first exposure to your allergen, it's going to cause what we call sensitization. So it's the same thing as we look at primary response. So first, the B cells are going to be activated. They're going to start changing to plasma cells and make antibodies. Those specific antibodies, more of them are going to be IgE. So IgE, remember, is going to cause basophils and mast cells to release histamine, cause inflammation. And we think sometimes these antibodies that are made for kind of allergies or whatever you're allergic to can be at least some form genetically determined as well. So you're already in your genetic disposition to react to specific allergens. Once you kind of are getting ready, so this is kind of getting ready for getting exposed to this allergen again. So you have a exposure to an allergen the second time. Then we're all ready. We have our IgE, we're ready to stimulate our mast cells and our basophils. So you're going to have a larger release of histamine. And so larger response of histamine is a larger amount of inflammation that you'll see. So this is really when you're going to see the signs of allergies that we think of normally. This you may just kind of not notice that you're exposed to it, but once you're exposed to it again is when you actually see the issues. So remember histamine, vasodilation, leakiness of our vasculature or capillaries. So these are going to be our inflammation. This is when inflammation isn't necessarily the best thing because it's inflammation on something that's not meant to attack you. So you get runny nose, itchy, you can get hives, watery eyes, all those symptoms that you see. You can get swelling, so edema because of the fluids from the capillaries. It can increase mucus production, so that's where you can get the runny nose and can get stuffiness. So that's increased mucus. And it can even constrict the bronchioles. So it'll make sure the bronchioles are actually tightened. And so that can cause increased respiratory effort. This is going to be in the more severe. So if you're constricting bronchioles, you're increasing kind of the effort it takes to breathe in because you're normally breathing in a hole this way, just breathing through a big straw. If you're constricting the bronchioles, which are in the lungs, and you're breathing through a straw that's this big, well, it's a lot harder to get air in this guy than it is in this guy. So this can be where it's just trouble breathing from constriction of the bronchioles if it's that severe. So again, first exposure to your allergen, you have helper T cells activated because the macrophages are an antigen presenting cell as well. They're going to recognize the allergen as foreign material and they're going to present it on its MHC2 to helper T cells to be activated. Remember, they have to help B cells. B cells are going to be recognized. This is why we have a considered genetic component because they have a receptor for this allergen. Produce plasma cells, which are our effector cells, and they're going to produce antibodies. And specifically, it's going to be the ones that go to mast cells and basophils for IgE. So we have immediate hypersensitivity. So this is going to be your response. You are exposed to your antigen and you have a quick and large response to it. So this is going to be more your allergies that we think of. So you are exposed to some sort of pollen, some sort of allergen. You have allergic rhinitis, which is inflammation in the nose. So this is going to be nasal membranes are going to be swollen. There's going to be redness, leakiness, all of those things. We actually think about 15% of the US actually has allergies to something. And oftentimes this response, even though you kind of feel you don't feel good, but the response is just in the nose. So it is just allergic rhinitis. So you'll see stuffy nose, you might see runny, you might see kind of swollen, things like that, but it's just in the nose. It's not affecting anywhere else. So you have a hypersensitivity reaction, meaning you've already kind of been exposed, you're exposed again, you get this issue. So allergic reactions can be localized. So there's going to be inflammation. So allergic rhinitis is that example. So this is just in the nose. It's not going to be in your lungs, in your abdomen, anywhere else. So you can even have kind of hives in one area. That's localized, meaning it's in one spot. Or you can have systemic reaction where the allergen is actually in the blood. So then it's going to circulate a lot farther versus if it's just attached to the nose and the nasal membranes, it's just going to affect that area. If it's circulating your bloodstream, this is going to be everywhere. So this is going to be your extreme reaction because your allergen is going all over the place, stimulating your immune system all over your body, and that's causing the issue. So you have itching, swelling, difficulty breathing because of those bronchial constriction. So this is anaphylaxis, where you actually get that allergen circulating throughout your body and causing issues everywhere. So again, this is going to be the exposure to the allergen again. You've already been sensitized. So mast cells have their IgE on it. So instead of even being produced by B cells, they're ready to go. So allergen can come in, attach to the IgE. Mast cells and basophils are going to release a large amount of histamines and other kind of messengers that cause the inflammation. Again, if it's localized, then it's going to be just in the body surface in one area. So you can even have hives, is fancy urticarias, fancy term for hives. So you can have it in one section. If it's systemic, then this is anaphylaxis, where you're having kind of the severe reaction where you need an EpiPen. So you need an injection of epinephrine and oftentimes an antihistamine as well to calm down the reaction of the histamine because you're causing vasodilation so quickly with so much histamine released that, remember, you're increasing your diameter of your blood vessels. That's going to decrease your blood pressure. So epinephrine is going to be a vasoconstrictor to oppose that and increase your blood pressure again. So kind of among other things. And then you can give an antihistamine to stop kind of the release or the effects of histamine as well. So more well, this is emergency, and this is just more annoying. So again, anaphylaxis, systemic hypersensitivity reaction, this antigen circulating everywhere. So it's affecting mast cells all over the place. More mast cells stimulated, more histamine. So the more histamine, the more these effects. So again, like I mentioned, vasodilation causes the drop in blood pressure. And this can cause issues where you're not having enough blood flow to all your important organs, and it can cause collapse or shock. So anaphylactic shock, where you need reaction, kind of medical intervention immediately. So EpiPen is going to be, or epinephrine injection is going to be the major one.